Holding back urine for too long and too regularly will weaken your bladder muscles that control the flow of urine. The more you put off emptying your bladder, the more it stretches out, which can result in an overstretched bladder. When that happens, your body starts completely missing the cues that your bladder needs emptying. Holding urine for extremely long periods of time can be dangerous. It can cause bacteria to build up and multiply. In severe cases, this bacterial buildup can cause urinary tract infections, or UTIs, which occur because bacteria have made their way into the urinary tract, which then causes frequent and painful urination. In extremely rare and serious situations, holding urine for too long can lead to a bladder rupture, which can be deadly. This could lead to urinary retention, where you are unable to fully empty your bladder. It can also result in loss of voluntary control of urination, which can result in leakage. The more you put off emptying your bladder, the more it stretches out, which can result in an overstretched bladder. When that happens, your body starts completely missing the cues that your bladder needs emptying, and that can lead to some pretty embarrassing accidents. Holding back urine for too long and too regularly will weaken your bladder muscles that control the flow of urine. Your bladder keeps the urine sterile, but as soon as it leaves your body, it can pick up bacteria from the urethra and air. Your bladder is like an elastic muscular bag that expands and contracts as it fills and empties, and it is about 5 centimeters long but can stretch up 15 centimeters depending on the amount of liquid. Your bladder can hold about 1 liter of liquid before it reaches capacity. When your bladder is about half full, it activates tiny receptors in your bladder wall. The nerves signal your brain that your bladder is getting full and needs to be emptied. The bladder muscles then squeeze. The tiny muscles in the urethra open up and urine flows out. When your bladder is empty, the muscle wall inside the bladder makes folds and tucks in. As the bladder is filled with liquid, the muscle wall expands and the bladder moves upward toward the abdominal cavity. This stretching increases the size of the bladder to accommodate the urine. The bladder has an internal muscular valve, known as the internal sphincter, which prevents the leaking of the urine from the bladder. The shape of the bladder prevents urine from flowing back into the ureters, which is the tube that carries urine from the kidney to the bladder. You have an overactive bladder if you need to pee more than 8 times a day. Urine is 95% water, and the rest is urea, a combination of salt, hormones, nutrients, and creatine. Women have shorter urethras than men, making them more susceptible to bladder infections as a result of bacteria from outside the body being introduced into the urinary system.